I mean, there's been a lot of advances in artificial intelligence, or more specifically, a strand of artificial intelligence machine learning over the last kind of 3 or 4 years, specifically around object detection in images, which has got a lot of applicability in healthcare around areas such as radiology and dermatology, and also around kind of text analytics as well, and using kind of predictive analytics to stratify patient risk. So there's a lot of kind of good work going on in that space, but there's a number of challenges in terms of getting these services or getting the AI regulated so that it can be used in routine clinical care. So there's a lot of great work going on, but we've still got some way to go. Well, I think, I mean, if you look at the Apple Watch, it now provides kind of an ECG, and I would predict that over the next kind of 3 years, there'll be more ECGs taken outside of the hospital system using kind of Apple Watches and other similar devices than will be inside the hospital. And so this kind of technology, which does use artificial intelligence to help diagnose patients with arterial fibrillation, that's kind of democratizing access to that type of technology, and, you know, it has kind of major implications around preventative care models. Yeah, that's a major problem at the moment. Is a lot of the data is siloed, and that's both from the patients with a lot of these very sophisticated apps and sensors. They can't share that back to the clinician, and equally it's very difficult for clinicians to share information back to patients digitally. And so I think we certainly think there's a need for a new kind of digital infrastructure to act as a system of interoperability between a lot of these digital therapeutics and diagnostics and the kind of existing care system. We built out what we call the Linus Health platform about 2 years ago to act as that system of interoperability. And at the heart of it allows us to aggregate data from devices, sensors, and digital apps and services, and connect that back through into the care system. And a couple of key points around it, it's got kind of privacy architected into the heart of it, so patients are in control of the data and they must consent to share that data. And also the platform is open, so any developer of a device or has a service can connect into that platform using the developer portal, so you can create a broad ecosystem of services.